At our office, we have found that different kids need different kinds of behavior management to get through their treatment, and that ranges. We've had 2-year-olds that can do treatment with nothing at all. We have 2-year-olds that need to be put to sleep. It just depends on the child and what the treatment needs are. Here, we try to take the most conservative approach. The most conservative approach would just be able to talk your child through a procedure, using some distraction, having them watch TVs, which are on the ceilings, listening to music, talking them through, explaining step by step what we're doing to get them through that. Now, if that doesn't work, we have other very conservative ways to also get to the same goal. One of the things that we offer here is nitrous oxide. It's completely reversible. It's just what you probably remember growing up as laughing gas. That's applied to the child, and they get to pick their flavor, and they smell that, and it just kind of takes the edge off. It makes them feel a little bit more relaxed. Now, we know that that may not be enough for every child, and so what the other service that we can provide here is an oral conscious sedation. That's to take a child that's fairly cooperative, a little nervous, maybe they have a lot of treatment, and maybe their fear's a little bit more than we can handle. What we would recommend is an oral sedation. Now, that's going to take the child that's fairly cooperative and make them much more cooperative, so that the procedure is easier for them, and we can ultimately get the treatment done in a safe environment with your child having a good experience. For the very young patients and patients that have very extreme fear or special needs, we offer IV sedation. We bring in an anesthesiologist that's been coming to our office for 7 years, and then she can put your child to sleep, and we can do everything that your child needs on that day. Your child will wake up, have no memory of that, and everything will be done. Now, our goals in doing that is not for your child to have that every time. But sometimes when patients come in, they come in with a lot of fears, they come in with a lot of past experiences. Sometimes one of those treatments is necessary to get them through. And then our goal from there on out is to develop, positive experiences with them, treatments where they need nothing and they come in, they have good experiences, so that if something comes up in the future, we can rely on one of the more conservative approaches to get them through their treatment.